So through the use of the Catscan, we give that information to the Mako system. The Mako system now understands the size and shape three-dimensionally of a person's knee joint. In the surgery, we do our dissection the same way that we would do with standard instrumentations. And then we insert pins which hold a system of reflective discs. And these reflective discs are picked up by two eyes on the computer system. And now the computer can see where the joint is in space. And then we register the joint. We have a wand, and that wand is a very specific size, and that wand has its 4 reflective discs. We will touch different places on the joint so that now the computer knows where this joint is in space. We will rotate the leg around the axis of the hip, so now the computer knows by watching the array move in a circle, it can determine where the center of rotation of the hip joint is. And then we take the wand, the array wand, and we'll touch the ankle joint to show the computer where the center of the ankle is. So now the computer not only has the three-dimensional size and shape of the joint, it knows where the center rotation of the hip is, it knows where the center of the knee is, and it knows where the center of the ankle is. So now we can adjust our axes of alignment. That helps us within the bounds of proper alignment to make very subtle adjustments to help us balance our ligaments. We want the joint to be the appropriate length, the appropriate angle, the appropriate rotation, so that all components of that joint fit together and flow together in a seamless, functional fashion.